guys, hope you all are doing good and being safe. I think you guys have heard about a nasty and rare fungal infection which is affecting India and alerting us nowadays. So I know everyone know about that fungal infection which is called black fungi. So I am going to discuss about that black fungi, and also I am going to answer most requested questions from my followers. There are many misconceptions and misunderstandings going around the world. We have seen reports from India that this infection is affecting COVID-19 patients or who are recovering from coronavirus. First of all, we will see what is black fungus. It is medically called as mucormycosis and also called as psychomycosis. This belongs to the family is called Mucormycosis. This Mucormycosis family is having 8 to 10 fungus, but only Mucor and Rhizopus are easily infected to us. You guys should know there are many microorganisms are living around the world,
including this black fungus.
This black fungus can grow rapidly and have black-brown fuzzy appearance. It does spread from the fungal spore which is presenting in the air, so it's impossible to avoid. So now let's see about what is spore. So if the fungal infection started to grow in our environment, for the reproductive purpose, it will produce spore. Spore means it's kind of seeds. Imagine like a cotton seeds, how the cotton seeds blast and spread into the air like a cotton sponge. This spore also will blast and spread into the air. The thing is, it's a microorganism, so it cannot be visible into your eyes. So these kind of fungus are easily findable in our environment like dustbin, unclean air conditioner, spoiled vegetables or fruits, old bread, and even in our nasal cavities. And also always you can see these fungi in mud, sands and in the air. Now let's see who can get this infection. So whoever is having low immunity can easily get this infection. For example, cancer patient, HIV patient, who else getting lots of steroid like prednisolone, and importantly to the diabetic patient. So you guys should know that this is not new to the world, it's already living in the world, but it won't easily affect normally immunized people. If your immune system is healthy, normally it will prevent from causing infection. And now let's see how it can get into our body. There are 3 ways it can get into our body. One is if you have wound or any trauma in your body or skin, the spores can enter into your body. And next one is when you inhale the spore, it can go through your nose to the lungs. And the next one is if you eat spoiled vegetables, fruits or spoiled bread, it can go into your gut. Let's see the mechanism how it can infect us. When our lungs are get damaged, for example in the COVID-19 patient, our immune system gets suppressed. So these spores can go in our airway and nasal cavities and also in the sinus and invaded in our body's tissue. And also potentially it can spread to the eyes and it can causing blindness or the brain causing headache and seizure. And now we will see the signs and symptoms. Persistent headache. If the fungus get into your nose and get into your sinus and go to your brain, it will cause headache. Another one is one side swelling, localized pain, heaviness in your one side of your face, or else unusual lesions or redness. If it is affected on your respiratory system, you can feel cough, bleeding from your nose, severe chest pain, fever, difficulty of breathing, and also bleeding while you are coughing. So these symptoms are if your lungs is affected only, you can see. And also if it is affected in your teeth, you can feel tooth loosening or toothache. If it is affected in your eye, you can feel swelling around the eyes or you can feel blindness or else droppy eyes. If it is affected on your skin, you can see redness along with a black appearance. Now let's see about the signs and symptoms of severe cases. If it is entered in your lungs, you may feel difficulty of breathing. If it is affected on your skin or faces, you can see discoloration of your face. Formation of black crust appearance on your nose or face or eyes areas. Usually it can happen in one side. And finally, if it is enter into your blood, it can affect your another parts of your body like liver, heart, kidney
and other organs.
So now let's see the requested question. The first one is why it's only affecting the COVID-19 patients or whoever recovered from coronavirus. See, this COVID-19 infection is associated with secondary infection like bacteria and fungus. So this COVID-19 created perfect environment to this black fungus.
So this mucormycosis can be grow in acidic environment like
Low oxygen level, diabetic situation, high iron level, immunosuppression, with several factors including prolonged hospitalization with mechanical ventilators. So these environments are perfect to grow this black fungus rapidly in our world
nowadays.
Another question is it contagious? No, it's not contagious. It means it cannot spread from contact between human to human or animals. But it does spread from the fungal spore which are presenting in the air. Another interesting question is there having any link between failure to control sugar level and black fungus? Of course, that's the most reason why it's happening in India. 1/3 of Indian population is vulnerable to diabetic mellitus. We always use steroids. That is the main reason why it's suppressing our immune system. And also we never had COVID, steroids, nasal cannula and diabetics together. Now we will see the statistic about this fungal infection. As of March this year, there are 41 cases of corona patients associated with this fungal infection, with 70% in India. But nowadays reports suggest that the number of cases are much more higher than before. There are only few countries associated with this fungal infection than India. We can see Pakistan and Russia are also seeing surge in this fungal infection nowadays. So please be aware of this infection. If it is infected in your body, it's very hard to cure. It have high mortality rate. It means the death rate is very high. Death will happen more than 76% if it is entered into your lung and 96% if it is entered in your brain. So guys, please be aware about this infection, especially who are having COVID-19 or who is recovered from coronavirus. Normally this fungal infection will not invade in our body unless your immunity is compromised. So try to boost your immune system and also stay safe and healthy. Bye bye.